Oh, hi, my name is Jane Anaji, and I'm here to check up Suki on medication administration for topical, oral, and inhalation. And today is Tuesday, February 11th, and the time is 11:55.
Okay. And this is the scenario. Okay, cool. Hello. Okay, so the first thing that I would do I would be looking at the order and the chart, and I would be checking the medications against the order as I pull them from the AccuDose, or whatever system the hospital currently uses. So the first one is cholestyramine, 4 grams, 3 times a day. The next one that is ordered is a nitro paste and a 1-inch topical paste. We actually don't have that in the chart. So what I would do if it's not in the chart is I would contact the physician and verify the order. But later on, in case we did have to, I'll discuss how to administer. But I would obviously never give medication that wasn't in the patient's chart. And then the inhaler, which is also not in the... I don't understand. Okay, so same idea. It's also not in the chart, but I would verify with the physician, but I'll also talk about how to use the inhaler. Okay, and since we don't actually have the ointment, we're just going to be pretending with this. And this is the measurement unit I would use to administer the medication. So now that I have the 3 medications and I've checked them against the order, I would bring them into the patient's room. With my nice cart on wheels with scanner. Okay, so I would come into my patient's room. I'm going to use this as a table. And say, hi, my name is Suki Hoffman. I'm a Liberty University nursing student, and I'm here to give you your 3 medications. Can I have your name and date of birth, please? And I wait for the patient to give name and date of birth. And I would confirm it against their wristband to give 2 forms of identification. Then I would scan the wristband, and then the second check for the drugs would be to scan them into the cart, or the computer. And if anything were to come up that said, do not give this, I would stop and obviously not give the medication to the patient. Okay, so while I'm giving the medications, I'd want to make sure that I would be paying attention to the red rules and the 6 rights of drug administration, which are the right patient, the right drug, the right dose, the right route, the right documentation, and the right time. And we check those against the order so we know they're okay. And the last check for the medications would be while we were preparing them. So, my nice invisible table. So again, I'm going to be checking cholestyramine against the order, 4 milligrams per tablet. And I would be wearing gloves for this procedure because I wouldn't want to put any contaminant into their body. So it's 1 tablet. So we can put that, whoops, just 1. And we talked about if there's any excess, it would be waste, but since this is a simulation, I'll put that there. So then I would mark it next to the medication just to make sure I wouldn't mix it up. And then I'm just going to put them right here. Okay, so I would be giving the oral medication first, and because it's a tablet to treat with cholestyramine, it's to treat primary hypercholesteremia, which is what the patient has. And before I would give that, I would assess their diet history. And I would have the patient sit up so they're in an upright position. Oh, well, I'm not. Yeah, so they're sitting up in an upright position. I would offer them some water unless they were ordered nothing PO. So I would have them tilt their head back, and they could give the tablet to themselves if they were able to, or I could assist them if they're not able to lift their hand. So they would tilt their head back and swallow it with a sip of water. Okay. The second medication that I would give would be the inhaler, which is, I looked it up earlier, I made you a cheat sheet, of course you can. Okay, so flunisolide. And it is an anti-inflammatory steroid which is used to help treat the inflammation due to asthma, which the patient also has. And the dose is 1 milligram, which is 2 inhalations. So I would, again, sit my patient up into the upright, like sitting up. Ooh, I sit the patient up, sorry. Okay, so we're sitting up, and I would ask the patient to take, I could shake it, ask the patient to inhale deeply and then exhale deeply. and as they're blowing out all the air, as they were getting ready to, as they started to inhale, I would push the inhaler to administer the dose, and then have them inhale for 3 seconds and then hold it for 10 seconds. And then I would give them a couple seconds to catch your breath again, and then repeat the process. So exhale deeply and then inhale as they're inhaling, push the inhaler to administer the second inhalation, and then have them inhale for 3 seconds and hold for 10 seconds. If the order had a spacer involved, I would also want to make sure they're using a spacer, which just allows for a better take-up of the medication, because it increases the time that the medication is in the chamber. Okay, and the last one would be the nitroglycerin, which is used to treat the angina that the patient has been experiencing. And we would use a non-hairy patch of skin, and we would not want to use the same patch of skin that's been used previously. So we could put it on the patient's arm or on the thigh, something that wouldn't be coming in contact with a lot of traffic on their skin, I guess. We could clean the area and make sure with an alcohol pad and make sure that the area is completely dry before we administer anything. And we would hold it, the dose was for 1 inch topical, so we would hold the scale right next to their arm. Ideally it wouldn't have so much space, but we would administer a 1 inch paste line, and you wouldn't want to rub it in or massage it in. And then the last thing that we would want to do is make sure we document everything properly, including the patient's response within 30 minutes and within an hour. And that would be included in the documentation, and then that would be the last. Right.